4 सालों के बाद दर्द से राहत। केन्या की एक 17 वर्षीय किशोरी पर मुंबई के अपोलो स्पेक्ट्रा अस्पताल में हुई हिप रिप्लेसमेंट सर्जरी। सर्जरी के बाद मरीज फिर से अपने पैरों पर चलने लगी। मुंबई असहनीय दर्द के कारण चलने में दिक्कत का सामना करने वाली केन्या की 17 वर्षीय किशोरी मरियम अब्दुल्ला मोहम्मद अली पर मुंबई के अपोलो स्पेक्ट्रा अस्पताल में सफलतापूर्वक हिप रिप्लेसमेंट सर्जरी कराई गई है। प्रसिद्ध जॉइंट रिप्लेसमेंट सर्जन डॉक्टर सफलत नदवी द्वारा की गई इस प्रक्रिया ने मरियम को नया जीवन मिला है। अपंजीकृत व्यापारचन केन्या में एक असफल सर्जरी के कारण 4 साल तक पीड़ा सहने के बाद वह दर्द मुक्त होकर चलने में सक्षम हो गई है। मरियम की परेशानी 4 साल पहले एक सड़क दुर्घटना के बाद शुरू हुई, जिसके कारण विपक्षीय फीमर स्क्रू फिक्सेशन हुआ। सर्जरी के बाद उसे चलने में दिक्कत आने लगी। उसके पैर के छोटे होने से उसके कूल्हे के जोड़ पर असमान दबाव पड़ा, जो समय के साथ खराब होता गया। मरियम का वजन भी काफी बढ़ गया था, जिससे उसके कूल्हे पर अतिरिक्त दबाव पड़ा। दैनिक गतिविधियां वह बिना किसी सहारे नहीं कर सकती थी। मरीज की बिगड़ती सेहत को देखकर परिवार वालों ने उन्हें अपोलो स्पेक्ट्रा अस्पताल दाखिल किया। यहाँ तुरंत सर्जरी करने के कारण मरीज को नई जिंदगी मिली है। अस्पताल में मरीज की वैद्यकीय जाँच कराई गयी। अपोलो स्पेक्ट्रा अस्पताल के प्रसिद्ध जॉइंट रिप्लेसमेंट सर्जन डॉक्टर सफलत नदवी ने कहा कि तारांकन, जब मरियम हमारे पास आई तो वह बहुत दर्द में थी और चलने फिरने में कठिनाई महसूस कर रही थी। सर्जरी के बाद की जटिलताओं और उसके वजन बढ़ने के कारण उसके कूल्हे के जोड़ की स्थिति और खराब हो गई थी। MRI स्कैन सहित अन्य मूल्यांकन के बाद उनका हिप रिप्लेसमेंट सर्जरी करना काफी जरूरी था। हिप रिप्लेसमेंट सर्जरी में हिप जोड़ के क्षतिग्रस्त हिस्सों को कृत्रिम प्रत्यारोपण से बदला जाता है, जिसे प्राकृतिक संयुक्त गति की नकल करने के लिए डिजाइन किया गया है। ये प्रक्रिया के कारण मरीज को दर्द कम होता है और मरीज सर्जरी के बाद कुछ ही दिनों में अपने पैरों पर चल सकता है। तारांकन डॉक्टर नदवी ने आगे कहा कि तारांकन प्रक्रिया के दौरान हमने क्षतिग्रस्त जोड़ को एक उन्नत प्रत्यारोपण से सावधानी पूर्वक बदल दिया। हिप रिप्लेसमेंट सर्जरी के बाद वह अब चलने लगी है। ये सर्जरी मरियम के जीवन में एक महत्वपूर्ण मोड़ साबित हुई। सालों से उसके माता पिता ने उसे दैनिक गतिविधियों के साथ संघर्ष करते देखा था, जो किसी भी परिवार के लिए एक दिल दहला देने वाला अनुभव था। मरियम के माता पिता ने कहा कि तारांकन, अपनी बेटी को हर दिन लंगड़ाते और दर्द से जूझते देखकर हम काफी चिंतित थे। वह अक्सर तनाव में रहती थी। दैनिक गतिविधियों के लिए वह हम पर निर्भर रहती थी, लेकिन डॉक्टर सफलत नदवी और उनकी टीम ने समय रहते हमारी बेटी का इलाज करने के कारण वह फिर से अपने पैरों पर चलने लगी है। हिप रिप्लेसमेंट सर्जरी के बाद उसे नई जिंदगी मिली है। हम उसके भविष्य को लेकर आशावादी हैं। सर्जरी के बाद मरियम ने अपना आत्मविश्वास वापस पा लिया है और अब वह अपनी शिक्षा फिर से शुरू करने और अपने सपनों को पूरा करने के लिए उत्सुक है।
It is honor to have you all people over here and to work as a consultant in Apollo Spectra Hospital at Tardev, and it is a privilege to perform such surgery on such a young patient at this center, as this center is having all the best equipments which is required for the surgeon to perform and deliver excellent results. This patient came to us from Kenya, and she was operated at the age of 12 years over there after the surgery, and over there they did a surgery with the screw placement in both the hips, and after the surgery she wasn't able to walk and she was having pain, and there was a limb length discrepancy of around 1 centimeter, and because of this she wasn't able to continue to do her school and do daily activities, after which she tried to go to several centers at her hometown, but she wasn't able to get the treatment which was required over there. So somehow she came to us, and so the challenge for this patient was that she was too young and epiphysis just closed, and the bone quality was challenging for us, and the most important part and the difficult part was to remove the implant. The implant placement was not in proper position, so it was very difficult to remove the implant, and it was around 5 years old surgery, so the bony growth was there around the implant, and it was a challenging task for us. And also for another challenge for this was to achieve the length, which the patient had the shortening of 1 centimeter, and also to restore the hip and to balance the hip and have a proper rehabilitation program after the surgery. So, and actually what is total knee replacement? So total knee replacement is there where total hip replacement is where we replace the hip. This is ball socket joint where the acetabulum, and that is we call it socket, and the ball is the femoral head. So that you can see the arthritis which has occurred over here. So we take a posterior approach and we try to excise the femoral head and the acetabulum, the cup, we remit, we try to achieve the cup size which we do the templating pre-surgery, and once this is been done, so we place the final.
She was posted for a very complicated surgery. Now, in general, any joint surgeries carry a higher risk than the general procedures that we perform because they put the patient through the heart through a stress. That is, the chances of embolism are higher because of any bone fragmentation, and if the joint catches infection, then there is septicemia. So, additional to all of these complications, in Mariam's case, she was obese and was going to be operated on a joint which was previously already operated. So these two were a very high challenging pointers for us. So my skilled team, we devised an personalized, customized plan, anesthesia plan for her, considering her age, considering that she was not from an Indian origin, because there are certain bodily geographical conditions which are different. And with the skilled surgeon that we had on our team, the state-of-art technology that is available to us at this center, we carried on the anesthesia under spinal anesthesia very smoothly. After the procedure was done, she was followed up post-operatively also and made sure that she was comfortable. So happy patient makes the surgeon happy, and that makes the anesthetist happy.
Good afternoon, ladies and gentlemen. Ladies, so gentlemen, so to begin with, as rightly said by Dr. Natri and Dr. Monica, there was a perception in everyone's mind that wherever there is a complicated cases, it has to go to a bigger hospital setup, tertiary care setup, where under one roof you will find everything, right? So whenever there is any kind of emergencies happening in our family also, we rush to a bigger hospital, not to a smaller setup. By seeing this 15,000 square feet setup, nobody would can imagine in past that this kind of complex surgeries would be happening in this kind of a setup, right? So day by day, the innovation is coming into the market. We are understanding the disease very well. So it's not the size of the hospital, it is purely depending on the specialization and the kind of a care a hospital gives to the patient. So that is very important for everyone to understand. Now the healthcare has to reach every corner. It is not easy for each and everyone to reach to the bigger tertiary care hospitals to find affordable healthcare with the best of the equipments available in the market. So that is how we differentiate ourselves as Apollo Spectra hospitals. You won't be finding so many hospitals with a similar brand name available in entire India. We cover around 22, we have 22 centers with 16 cities which cover, and this is primarily secondary care setup where we planned our cases very well, so the outcomes are far best. We have been applauded with most of the good awards in last years. One of the awards which we recently got was Gold Award for Best Healthcare Delivery Brand at the 9th India Health and Wellness Summit. Whereas not only orthopedics, in this kind of a setup we are able to give you laparoscopic surgeries, ENT surgeries, urology surgery. All these surgeries are very well planned. It's not an emergency, so you need a setup where very well planned surgeries can be operated very well. So
it depends on the experience and how much number of the cases, because this type of case, but she was older than this lady. We have done in previously, and we were expecting that this would be giving her a better result, and it would be a painless and mobile hip, which she is very happy with it.
Okay, I would like to ask Mariam, how did you find out about Apollo and how did you have that confidence that this hospital is the one worldwide? Because you are from Kenya.
This hospital was recommended to me by my aunt, and I did some research on Google, on the website, Apollo website. I saw that Dr. Beauty had 13 years experience, and I was convinced that he would help me.
Great. And now that the surgery is over and you are able to walk, you are able to feel confident that now this is the right surgery that has gone through. And what are your dreams and goals that you want to fulfill now that you have become all right?
I want to be able to do my daily activities that I used to do before my surgery 4 years ago, and yeah, I want to be able to do everything normally again.
Doctor, now that you have fixed this, how about sometimes there is a rejection of the body for different materials which come in?
Yeah, we have already kept her on antibiotics to take out any, take care of the infection and other problem, because it is a secondary surgery. So till now she is doing well, and we have given her all the instruction, and my team is there, who are my junior doctors are there, who are in touch with the patient. If any problem is there, anything is there, so they can coordinate with the patient, and patient can also coordinate with the doctor, and even she can coordinate with me also. And there is our excellent rehabilitation physio center department, who are also looking after the patient to develop the muscle and release the stiffness of the muscle. So every day she is improving, and I hope she will do much better with this.
Great. So on a short-term basis, you said 3 months she has to take medicines and everything. How about long-term? Supposing after, let's take 3 years, 4 years, when she's completely all right, what care she has to take?
Long-term, one thing which I have recommended her to lose the weight, because she, at her age, the weight is on the higher side. So this is what one recommendation is there. Otherwise, she will be doing excellent. I hope there will be no problem with this.
Doctor, my question is, what precaution one is to take to prevent osteoporosis?
Yeah, the precaution which we tell usually the people to have a proper sunlight exposure, have a proper vitamin D3 analysis, and have a calcium intake, that is milk intake, egg intake. If anybody is taking who is a vegetarian, and they can take egg, that is much better, and fish, that must be included in the diet. So most important thing is the daily intake of milk is important thing. If you are not taking milk, then you have to take a supplement of the calcium.
In earlier days, when such a hip joint operation was being done, so most of the cases there was a leg, like the length of the leg used to deter.
Yeah, your question is that earlier there was limb discrepancies used to be there. So that is what is with newer implant and newer technique, that thing has been minimized with this.
So now most cases are precision, there is precisionness in most of the cases.
Obviously, because this has helped us, because we have a better templating, better pre-surgery plans, and on intra also we are in a better position to place the implant and get a better result.
And after the operation is conducted, how means the patient in what time is discharged nowadays?
Usually we discharge on the second day, but for this patient we have to wait for 3 to 4 days, because we have to give antibiotics, and the surgery time, it took little time because to remove the screws. Usually when we do a primary hip without any redo surgery, if it is a primary hip replacement, we discharge the patient on the second day. There is no issue.
And the material which is used for the hip replacement, so does it last long? There is no need of
Obviously,
resurgery.
this is the one important part which was there on my slide. The most important and challenge for this young age patient is the survivorship of the implant, like how long the implant is going to survive. So usually in our data, in our presentation and journals which are being presented all over the world, and our experience, it shows that around 15 to 20 years it goes on. So it can go further if the patient is able to take care of her herself.
Sir, regarding the hip implant, is it this kind of rare surgery which is there? Is the implant affordable and accessible? And second thing is that there are 2 lakh joint replacement surgeries done annually. Out of that, how much is Apollo doing, and how far the Apollo can do it? Compared, and do we have the self-reliance in terms of?
We have the joint registry data with us. So we are doing on an average every month 14 to 20 joint replacement at this center. So all over Apollo, like Apollo Chembur is there, Apollo Belapur is there. So those people have different data with them.
So India is equipped to handle such cases, like joint replacement.
Obviously, now
The demand supply.
now we are doing in much better replacement. That's why the people, they come from outside, especially from the Middle East, and from Africa, and other part of the world also they come to us.
But these hip implants, are they affordable, accessible? That's my last
There are
question.
different varieties of implant are there, but for her, what we have used is the best implant, that is Johnson & Johnson. So that is the best hip implant till now. And there are other companies also which are manufacturing. But for a young patient, as per our experience, this is the best implant.
But sir, is it like, what is the cost factor? Like, is it affordable?
Yeah, obviously,
Because here in India it comes under the scheduled category.
yeah, it is there under the scheduled category. It is there. It is affordable only.
What would be the cost?
So it depends on different implants, like what type of implant. Like sometimes it depends on the surgery. If I use the cup, I use maybe some extra plates, maybe I use bench. So those all implant cost, it goes up, and it can come down also.
Thank you.
Every patient has different choice of
Customized.
implant, and the plan of the surgery is also different.
सर जी, ये ऑपरेशन के लिए क्या कितनी डिफिकल्टी थी ऑपरेशन होने के लिए, और मरियम अभी ये ऑपरेशन समाधान है क्या?
ऑपरेशन डिफिकल्ट इसलिए था कि ये पेशेंट बहुत यंग है. यंग पेशेंट में हम लोग हिप रिप्लेसमेंट या नी रिप्लेसमेंट जल्दी नहीं करते. वो इसलिए नहीं करते कि 15-20 साल तक हमारा जो इम्प्लांट सर्वाइवरशिप रहता है वो बोन के साथ चिपका रहता है. वो फिर बोन गिव अप करने लगती है. जैसे साहब ने पूछा था कि क्या ऑस्टियोपोरोसिस का ट्रीटमेंट क्या है. फीमेल्स में अर्ली ऑस्टियोपोरोसिस बहुत जल्दी हो जाती है, तो वो एक रीज़न रहता है जिससे इम्प्लांट गिव अप हो जाता है. तो उसके लिए हमको रिवीजन करना पड़ता है. तो ये एज में हमने पेशेंट को भी समझाया है, इनको बताया भी है कि आपको अपनी डाइट लेना है, अपना वेट कम करना है, अपनी एक्टिविटीज़ क्या क्या करनी है, वो सारे प्रोटोकॉल्स हम इनको पेशेंट को बताते हैं, सर्जरी से पहले भी, सर्जरी के बाद भी.
आपके यहाँ पे सुविधा क्या क्या उपलब्ध है ऑपरेशन की?
यहाँ पे तो सारी सुविधाएं उपलब्ध है जो एक प्राइमरी सर्जरी के लिए. ऑलमोस्ट एवरी सब इक्विपमेंट यहाँ पे है ऑपरेशन थिएटर में. हमारे पास 4 ऑपरेशन थिएटर है और चारों ऑपरेशन थिएटर इट्स वेरी इक्विप्ड.
And what are the other facilities in this hospital, and can you elaborate something about the hospital?
That I think Ashfaq will be better person to answer that.
To answer your question, sir, thank you very much, because you should understand what kind of facility you are setting into. So this is around 15,000 square feet hospital. It's a very small setup, but a very complex and well-to-do setup. As rightly sir has shown in the PPT also, that we have robotic available over here. We have around 24 beds, 4 modular OTs, 4 bedded ICU. So whatever is required for doing any kind of planned surgeries, we are very well equipped with those equipments. In fact, we have latest equipment for all kind of surgeries, like you must have always heard about laparoscopic surgeries, the keyhole surgeries. We can do that over here. We can do urology, high-end procedures also, end-to-end procedures in urology, general surgery, ENT, spine, orthopedics. So all these surgeries are more of the time are planned cases. So we are aware of what kind of requirements are going to come, and we are very well equipped with all those things in this small setup. So normally investigation wise also we have X-rays, sonography, whatever basic investigations. We have our lab over here. So all blood tests are done in-house. So whatever is required for secondary care is available under one roof. So you don't need to have a big hospital or big picture kind of a thing. Everything can be very well managed in this setup.
Thank you.
Thank you.